Welcome to the Super Healthy Human podcast with Dr. Rodger Murphree.
Hi, welcome. I'm Dr. Rodger Murphree. I'm really just so delighted that you're going to be joining me tonight. I look forward to sharing some information that I think is going to be helpful in your quest to get healthy and feel good again for some of you. But tonight I'm really going to be focused on some of the GI problems that are so typical in a lot of the chronic diseases or chronic illnesses that I work with my patients. My specialty for the last 25 years is working with chronic illness, and particularly fibromyalgia and chronic fatigue syndrome. But I am the author of a few books, and I do work with patients with cardiovascular disease. I work with patients with type 2 diabetes, mainly with material and protocols that come from my heart disease, which your doctor won't tell you book. And then also have a book called Treating and Beating Anxiety and Depression with Orthomolecular Medicine. And then the fibromyalgia book, which is in its 5th edition, Treating and Beating Fibromyalgia. Those are available at yourfibrostore.com or essentialthera.com. But I'm going to be sharing with you information that I have gathered over the last 34 years in practice, 25 years specializing, as I mentioned, in chronic illnesses. One of the key challenges for so many of my patients is just cleaning up their diet and cleaning up their microbiome, getting their digestion and elimination systems to work correctly. It's incredibly frustrating, and I'm sure those that are tuning in or watching the replay know just how frustrating it is to have this thing called irritable bowel, where one day, you're in the bathroom all day with diarrhea, and then the next day you can't go for days and you're miserable. Feel like you're 6 months pregnant, you're bloated and have all the stomach pain and gas and indigestion. So we're going to be talking about how to quickly turn all that around. I'm going to talk to you tonight a little bit about food allergies and the elimination diet and how that is connected to a thing called leaky gut or intestinal permeability. And you may or may not heard that term, but it's a real condition that has been recognized and certainly being more and more recognized by the conventional medical practitioners. It's something in functional medicine, and functional medicine is what I specialize in, where we're looking at the underlying causes of these different diseases. That's functional medicine. And we're looking at what's missing or what needs to be added, preferably the natural raw ingredients that make the hormones and the chemicals that the body needs. Certainly a time and a place for prescription medication. Thankfully, we have them. They save millions of lives, but relying just on drug therapy alone is often not enough. And typically it's just covering up a symptom. A symptom is just a warning sign. So I want to share with you tonight, what are some of the underlying causes that may be contributing to your gastrointestinal problems, whether that's leaky gut, heartburn, or bloating and gas, constipation, loose bowel movements, food allergy reactions or sensitivities. If I have time, we'll get into yeast overgrowth, and I'm going to share the protocols with you. You might want to take some notes. You're welcome to take a screenshot of some of these slides that I bring up here in just a minute. This hopefully is not going to be one of my longer presentations. I'm going to try to keep it somewhat shorter so that I can save plenty of room for question and answers. So I want to just welcome everybody. These are 2 websites that I'm going to be mentioning tonight. There's a couple others, but these are websites where you can find a lot of free information, blogs, videos, interviews that I've had on summits, testimonials. It's all there. There's a lot of free information here, and this is where you want to find the resources that I'm going to be sharing with you tonight. Which typical in conventional medicine, we all grew up this way, I certainly did, is that, we had some type of symptom, whether that was a migraine headache or a racing heart or high blood pressure or pain, whatever it is. We went to the doctor and he or she gave us a pill, and that pill was supposed to reduce that symptom. And that was great. You took a pill and got over whatever it was. But taking a pill for a chronic condition doesn't work all the time, and it sets you up for potential side effects. And I use this example here. If every time it rains, you get water on your, in this case, living room floor, and you can mop it up every time that happens. I mean, you certainly can do that. But the water on the rug in the living room, that's a symptom. Yeah, it's a problem, but it's a symptom. It's a warning sign you got something wrong, right? So typically what we do is we take a pill to cover up that symptom. If you have high blood pressure, you take a high blood pressure pill. If you have type 2 diabetes, you're taking insulin or metformin or GLP-1 shots. Or an insomniac, you're taking a sleeping pill. But there's all there's always an underlying cause or causes to these symptoms, and symptoms are only a warning sign. So in this case, when we look at the water on the rug in the living room, yes, we can keep mopping that up, sweeping up, trying to clean up, but over time, this chronic symptom, this chronic problem is going to create a lot of problems, including it's going to destroy your carpet. It's going to create mold. It's probably going to destroy your underlying wood or whatever you have underneath the carpet. And so eventually it's going to be a real problem. And it makes more sense, rather than treating the symptom, which is the water on the floor, is to treat the cause, which is the hole in the roof. That's what we want to be treating. We want to fix that. We fix that. We don't need to be sweeping up the floor every time. We fix the underlying causes of your GI symptoms, and you don't have to be taking some of these medications that some of you are taking, whether that's Linzess or maybe you're taking some kind of medication like Bentyl, something to calm your stomach. There's all kinds of different ones out there, but those medications all have potential side effects. There's certainly a time and place for prescription drugs. I certainly want to advocate that. However, I have a problem with drug only, drug first, and certainly too many drugs and the wrong drugs. I certainly have problems with those. So where do we start? Believe it or not, for GI problems, we start with sleep. If you're not getting a consistent good night's sleep, you're going to find that every system in your body starts to suffer, including your ability to digest, assimilate, utilize, and then to void out the food that you eat. So you want to, be able to digest it. You want to be able to assimilate and use the nutrients. And then you want to, within a reasonable amount of time, typically within one day, within 24 hours, you want to eliminate all the waste that came from that food as well. You don't want it sitting there. But sleep is crucial. If you're not getting a good night's sleep, just some of the stats, you increase your inflammation by 40%. So some of you have a tremendous amount of inflammation, whether you have fibromyalgia or type 2 diabetes and you have inflammation in your nervous system, or you have cardiovascular problems where you have inflammation in your arteries called arteriosclerosis. But this inflammation is driven and is compounded by poor sleep. You want to make sure you're getting a good night's sleep. Now, I have resources on those two websites where you can see the things that I recommend to get a good night's sleep. For my fibromyalgia patients, I recommend you start with 5-HTP 30 minutes before bed on an empty stomach with a little bit of juice to help you fall asleep. 5-HTP, which is an over-the-counter supplement, an amino acid. That amino acid, 5-HTP, increases your natural sleep hormone melatonin by 200%. Also raises your serotonin level when it's combined with something like the fibro formula. So if you have fibromyalgia, you want to start with the 5-HTP. Now, if you don't have fibromyalgia, then you might want to just start with sublingual melatonin. So some of you have taken melatonin maybe in a capsule or a tablet and didn't work, but if you take it in a sublingual form where it dissolves underneath your tongue, you can see it bypasses the stomach where you may be having issues with absorption. And also it takes a while for it to kick in. But if you let it dissolve underneath the tongue, it gets right into the bloodstream and works within minutes. So typically I start my patients on 3 milligrams and they can go as high as 12 milligrams of sublingual melatonin, which we have in the store. Again, if you're a fibro patient, you want to start with 5-HTP because 5-HTP, when it's combined with the fibro formula, a formula that I developed years ago, it turns into serotonin. Serotonin is your happy hormone. The higher serotonin level, the higher your pain threshold, the less pain that you have, the deeper sleep you get into, and it helps with your moods and mental clarity. It also, as you're going to see, helps to regulate your bowel movements. It's very important. So let's look at what happens a lot of times with chronic illnesses is stress and inflammation really are the drivers of just about any illness out there, whether that's fibromyalgia, Alzheimer's, Parkinson's, type 2 diabetes, you name it, autoimmune problems like MS, Reiter's, lupus, rheumatoid arthritis. The inflammation and stress are the drivers that really put the fuel on the flames of these conditions. And normally when we're getting a deep sleep, we're getting, consistent deep sleep, our bodies are able to repair themselves. That's what is supposed to happen between that, 6 and 9 hours when you're sleeping. That's when the body is repairing itself, releasing certain hormones, certain chemicals that are designed to repair damaged tissue, whether that's muscle, bone, joints, organs, cells, whatever it is. It also allows the body to be able to detox the brain. And it's crucial for you to be able to get a good night's sleep. We make deposits when we go into deep restorative sleeps. Normally, we go back here. So all day long, we're making withdrawals of these chemicals that we need to deal with stress. Loud noises, bright lights, traffic jams, tax returns, whatever it is. It can be real or it can be imagined. If you're a nervous Nelly, you're just under stress all day long. But real or imagined, your body's releasing certain chemicals, certain hormones to help you deal with the stress that you are experiencing. When you go into deep restorative sleep, you make deposits into your stress coping account and you get a buildup of these chemicals for the next day. One of those is, as I mentioned earlier, serotonin. The higher your serotonin, the higher your pain threshold. It helps to block pain. The higher your serotonin, the happier you are, less anxious you are, and the less likely you are to have irritable bowel syndrome, specifically diarrhea, so irritable bowel D. We'll talk about that here in just a minute. So these are, serotonin receptors. You have more serotonin receptors in your intestinal tract than you do in your brain. That's why when you get nervous, you get butterflies in your stomach. So some of you have depleted your serotonin not only for your brain, but you've also depleted it in your gut. And this leads to the problems that we see with irritable bowel syndrome. You see that a lot of times, so what happens if you have irritable bowel? I'm going to share this and we'll get into some of the specifics of the protocol. But what happens with irritable bowel, what typically flares it up is what? Stress. So you've got inflammation in your gut and you've depleted your serotonin because you're not getting enough sleep. For some of you are just under too much stress and the body can't keep up with it. And now the body has a problem regulating your bowel movements. A lot of times you eat and you just have to go to the bathroom right away. You have loose bowel movements. That's called dumping syndrome. You eat and you have to run to the bathroom. So we're going to look at how this all plays out here in just a minute. Now, some of you may be taking antidepressants, prescription antidepressants, but no one has an antidepressant deficiency. No one has a Prozac deficiency or Zoloft deficiency or Lexapro or Effexor, you name it, that you don't have an antidepressant deficiency. Now, what those drugs are designed to do is to help you hang on to serotonin. And depending on the antidepressant, it could be serotonin and norepinephrine. That's why you see the S's and the N's here. But in a normal brain, when you take an antidepressant, it helps you hang on to the serotonin so that it's active longer and can yield its effects for a longer period of time. However, you got to realize that Prozac, Celexa, all these prescription antidepressants don't make serotonin. They only are designed to help you hang on to what you have. That's what a selective serotonin reuptake inhibitor does. It's designed to help you reuptake and hang on to that serotonin for longer and helps with pain, blocking pain, helps with calming you down. It's the happy hormone, all those things, all those positive things. But what you need to know is it doesn't make serotonin. It's only helps you hang on to what you have, kind of like a gasoline additive. So, some of you, and maybe this is dated, I don't know, I don't hear a lot about gasoline additives anymore, but used to be, and I think it's just still a thing, but I know for me, it was a thing where you would put this gasoline additive in your gasoline tank and you get more mileage, right? The problem though, is that so many people don't have any serotonin. When you get under a lot of stress and you deplete it, if you're depleted of serotonin and you're taking a selective serotonin reuptake inhibitor, there's nothing to reuptake. It's like using a gasoline additive in an empty gasoline tank. If you're running on fumes, a gasoline additive really ain't going to do anything. Same thing with these antidepressants. Now, I'm not telling you to stop any medication that you're on. Please don't, without working with your doctor. I want to share with you that these antidepressants are not without potential side effects, including, ironically, anxiety and depression, poor sleep, diffuse achy pain, brain fog, weight gain. Not that you're going to have one of those side effects, but it's certainly a possibility. So if you can look for a natural option, and I'm going to share with you some natural options tonight. One of those is just taking 5-HTP. So if you have any anxiety or depression issues, certainly if you have fibromyalgia, you want to be taking 5-HTP. And I'll show you those protocols here tonight. So my patients typically, if they have fibro, this is what they go on. They go on the fibro formula, which is a high dose, safe. They're all safe, but 500 times stronger than the RDA, the recommended dietary allowance, or what you get like an Essentium Silver or one a day or something like GNC that you pick up at the CVS, whatever that is. It's going to be 500 times stronger in the quantity. So it's going to have 500 times more than the RDA, which I call the recommended disease allowance, because it's, 1 milligram of thiamine is not going to do anything. 50 milligrams may actually allow you to think better, but 1 milligram, it's really not going to do anything. It's just enough to keep you from getting beriberi or scurvy, this RDA. So you need high doses, but safe doses. And the fibromyalgia formula has high doses of vitamins, minerals, amino acids, which are key to making your hormones that we're talking about tonight, as well as having key nutrients in there like malic acid that help with cellular energy and reduce pain. 5-HTP, 5-hydroxytryptophan, I recommend you use a 100 milligram tablet and nothing else with it. So some of the vendors out there have 5-HTP with B6 and other herbals and things. I recommend you steer clear of that. Just take pure 5-hydroxytryptophan. We have it in the store, so you can check it out. Now, if you're an individual struggling with your sleep, if you're fibromyalgia, start with 5-HTP. If you're not falling asleep after taking 3 of those, you start with 1 and each night increase. Then add the sublingual melatonin until you get up to 12 milligrams. If you're still not able to fall asleep, that's when you would add Delta Sleep. Delta Sleep is an all-natural formula I developed couple of years ago. It's got ashwagandha, gamma-amine butyric acid, L-theanine, glycine, some other things that are very calming, very relaxing, typically will allow you to wind down within about 15 minutes and put you to sleep. It can be taken during the night. So if you're one of those individuals like I used to be, I'm a recovering insomniac, if you wake up at 2 o'clock, 2:30 at night, 3 o'clock, whatever it is, and you just struggle to go back to sleep, the Delta Sleep is designed, you take 2 to 6 of those, and what you should see, it'll put you right back to sleep within about 15 minutes. So I encourage my patients to keep it on their bedside with a glass of water. And you get up to use, when you wake up at 3 o'clock in the morning and you go, oh no, here I am, get up, go to the bathroom, whatever it is, take it before you go to the bathroom, come back and what you should see is you fall back asleep within about 15, 20 minutes. It will not make you feel hungover, dopey, or sleepy the next day. You can wake up if you have a elderly parent, a special needs child, a spouse, somebody that needs your attention during the night, no problem. It's not like taking a sleep drug. And by the way, sleep drugs have been shown to increase your risk of death by all causes by 500%. I'm not trying to scare you. I'm just trying to share with you. You want to look for natural options for your sleep. And I've showed some more protocols where you can learn more about that, some free resources. One of the key things that's just driving irritable bowel and GI problems is just our diet. I tell my patients that for them to reverse their condition, no matter what it is, for them to do that, they got to get healthy. Now, everybody's different, so that means different things to different people. But I mean, I know it sounds simplistic, but to get to overcome your illness, you got to get healthy, right? And getting healthy is not defined by taking, a tray full of drugs. That doesn't make you healthier. Now, there's time and a place. What makes you healthy is finding and fixing the underlying cause and changing your lifestyle. So if you're like all of us, and this is how I grew up, and you eat the sad American diet, the standard American diet, you're eating a lot of processed food, you're eating a lot of seed oils that increase inflammation, you're taking in a lot of toxins that your body cannot utilize and has to get rid of. You do that periodically, no big deal. But if you do that every day or every week for the last 40 years, 50 years, 60 years, whatever it is, it's going to create problems. And you're going to start to see symptoms, which are warning signs, that's all they are, that something's wrong in your body. And that could be the bloating, the gas, the indigestion, the malabsorption, the yeast overgrowth, the rectal itching that you get with yeast overgrowth. It can be, again, the bloating, the gas, the loose bowel movements. It can be inflammation that can be triggered, go all over your body. You've got to clean the diet up. So what I tell my patients is to get healthy, you got to eat healthy. There's no way around that. You can't be healthy and not eat healthy. Now, again, I'm not talking about you can't ever have a hamburger every once in a while, or you can't have a dessert every once in a while. I'm not saying that. But the majority of the time, you need to be eating healthy if you want to feel good and stay that way. And if you're really run down, really sick, you've got to be even more vigilant with your diet. There's just no way around it. You just cannot shortchange that. Diet is the long game. I also share this with my patients. It's the long game. You're not going to see results in a week or 2 or 3, although you may start to. The nutraceuticals, the over-the-counter supplements that I recommend in my protocols, they start to correct the underlying issues. And then the diet is something that you do long-term that allows you to reap the benefits and continue to reap the benefits of getting healthy. So I'm going to talk to you a little bit about leaky gut. We'll get into irritable bowel here in just a minute. But if you look at this slide right here, what you see now, I'm looking at it to my left, so it may not be that way to you. But if you see these cells there at the top where they have these little round circular illustration there, you see the cells are together. They have like little stitches together. You see those three little stitches there. In our gastrointestinal lining, it's only one cell deep. That's it. So it's only one cell between you and the rest of the body. And what those cells are supposed to do, what your digestive system is supposed to do, is supposed to keep food, the nutrients, and the toxins in this plumbing system. The digestive system and elimination system is supposed to keep it in that system so that you absorb the nutrients and you get rid of the toxins. So normally when you eat, what happens is you start to chew up your food and it goes down your esophagus into your stomach, and then from the stomach goes in the small intestine. Typically, by the time it gets in the small intestine, that food stuff has been broken down to little bitty molecules. So like a protein. So if you eat just a turkey sandwich, turkey will be broken down. That protein in the turkey will be broken down into amino acids, which are the building blocks of a protein. There's 20 amino acids, and they make up proteins. Those amino acids then turn into certain hormones, like L-tyrosine is an amino acid that is T3, T4, depending on, you have to have that amino acid to make thyroid hormones. You have to have these amino acids to make the brain chemicals. So serotonin comes from 5-hydroxytryptophan, an amino acid that comes from L-tryptophan. This is how this works. So normally when that protein is going through the plumbing, it stays in there. And again, the nutrients are absorbed and the bad stuff stays in the plumbing until it's voided out, urinated, or you have a bowel movement. But if you look at leaky gut, what you see here is there's gaps in between the cells. You see those? So what you see now, you see those little blue balls there? Those are toxins that should stay in the plumbing, but now it's leaking across into the body. It's getting out of the digestive system, and the body doesn't know what to do with that. That's not how it's supposed to operate. So what it does is it releases inflammatory chemicals to attack this thing it thinks is a foreign invader. Your immune system goes into overdrive, and it starts to release these cytokines, which can destroy tissue, but they can cause inflammation and pain anywhere in the body, not just in your gut, but it can cause pain in your knee joint. It can cause pain in your migraine headaches. It can go anywhere and create problems. This is a real issue for most people. They don't realize they have leaky gut. It's about everybody with a chronic condition has leaky gut. It's contributing to their inflammation, contributing to their pain, contributing to their poor health symptoms. Just the majority of my patients went through leaky gut protocol to correct their leaky gut, which takes a couple of months, and we'll look at that here in just a minute. But you want to correct that. Now, how many of you are having problems? This is so typical of my patients, where you find you're able to eat less and less foods because you're getting these abnormal reactions. Probably a fair amount of you on here or who are watching the replay. It's very common. And what I would hear, over the last couple of decades specializing in chronic illnesses, Dr. Murphree, I'm getting to where I can eat less and less, and I'm getting reactions. I don't even know what I can eat anymore. A big reason for that is leaky gut. So it doesn't matter. It's not a food allergy. That's what makes it such a challenge, because you're eating something that you shouldn't have an allergy to, like, because you never eat it. The things that you develop allergy to are things that you eat habitually. And most people eat the same foods week in, week out. And you do that, especially if you have leaky gut. Now the body does start to develop an allergy to that food, because every time you eat it, or in the past when you've eaten it, it's leaked across and gotten into the body, and the body thinks it's an allergy producing equation. Number one, you want to have a varied diet. Number two, you want to make sure that you take steps, if you do have a chronic condition, to correct leaky gut. Well, you see how this little chart right here shows how the bad stuff is getting out into the rest of the body. So you think about our digestive elimination system being part of the body. And it is, but its job is to keep everything inside, allow the nutrients, the good things, to pass into the bloodstream to be utilized, and the toxins and waste material to stay in the plumbing until it's voided out. It's just like the plumbing in our houses. When you go and sit down on the pot and you do your business and you flush the toilet, you don't want to see it again. It goes through the house and then it goes somewhere where we never want to see it again, right? But when you have leaky gut, when you flush the toilet and it's going through the pipes, now all of a sudden down on the first floor, you've got a leak, and it's leaking all over the dining room floor or wherever it is. Literally, when you have leaky gut, you're mixing poo-poo, because it's waste material is what it is, with your body, and it's incredibly toxic. You want to take steps to start to fix this. And we're going to talk about that tonight. The first place to start with leaky gut, with irritable bowel as well, is making sure you're taking a digestive enzyme. So you definitely want to do that. You want to be taking a good probiotic, and you want to be taking the amino acid L-glutamine. L-glutamine, another amino acid, is responsible for repairing. It's responsible for the nutrition, for the energy of these cells to repair themselves. Without it, you really can struggle to repair this. With taking digestive enzymes, probiotics, and L-glutamine, you want to get plenty of fiber. So inulin and glucosamine, N-acetylglucosamine, which is a fiber product, and N-acetylglucosamine, which is in the leaky gut formula that I've developed, is designed to pull these tight junctions together to mend these up. But diet, if you clean your diet up, you're going to see leaky gut will be repaired typically within a couple of months. But again, here's another slide. You can see here the normal tight junctions, and that keeps the pathogens out from getting into your gut, but it also keeps the pathogens from getting out of your gut. So you see here on the other side, the leaky gut side here, these toxins and food stuff is actually leaking across, both good and bad stuff, is getting into the rest of the body in the visceral cavity, and the body is freaking out because it doesn't know what to do, so it generates this inflammation. And over a period of time, now you can start developing food sensitivities or food allergies, thinking that it's a true food allergy, but really it's coming from leaky gut. You want to really clean your diet up. So least inflammatory foods, which have a healing property for the gut, are leafy greens. You can see greens, spinach, cabbage, beets, or beet greens, Swiss chard, arugula, bok choy, turnip greens. I also like the Brassica family. That's really important, like cauliflower, Brussels sprouts, broccoli, kale. Those are things that can really help. Kale's actually in the greens. But Brassica family can really help to tone down inflammation. Big reason why is because it helps your liver work more effectively. Your liver is part of your digestive system, and these the Brassica foods can really help with that. Mushrooms, as long as it's not psychedelic mushrooms, can also be really, if you're a mushroom person, I'm not, but they can also really be helpful in repairing the gut. Berries have such a high antioxidant content. They help to squelch what's called ROS, reactive oxidation species. That's a mouthful, but that's inflammation that's generated in our bodies as a defense mechanism. It's something that we need. It just happens. But berries in particular, blueberries, strawberries, blackberries, raspberries, they're really good at providing the antioxidants and the flavonoids, the chemicals in these berries, to help to heal up the gut and to provide an anti-inflammatory reaction. So you want these. Now, I do want to recommend that you try to eat your berries organically. You don't have to eat everything organically, but if you look up Clean 15 and the Dirty Dozen, so the Dirty Dozen are the 12 foods that you really, really need to be cognizant about eating them in an organic state because they're so heavily treated with pesticides and fungicides. Most berries are in that category, as are peaches and some other things. Things that really don't matter are bananas and apples, things with peels. But you can look it up. The Dirty Dozen, so those are the dirtiest, unclean, overtreated foods that are out there. And then you can look up the Clean 15. Olive oil. I really want to encourage you to use cold expeller pressed olive oil, EVO. This monosaturated fat is an anti-inflammatory. And I use it liberally. We use it, we use it in our vegetables, use it in our salads. We use a lot of olive oil in our household and eat a lot of olives. I eat olives as a snack. It's a good, healthy snack. It's good, healthy fat. Fat's not unhealthy if it's healthy fat. I'll call seafood is another way to generate this omega-3s. So you have two essential fatty acids, omega-6 and omega-3s. Omega-6 come from grains, industrialized fed cattle, and livestock, including chickens. Omega-3s come from deep cold water seafood, come from grass-fed cattle and free-range chickens, including their eggs and milk and the dairy that we get from cattle. Omega-3s are anti-inflammatory, so that you really want to skew towards getting more omega-3s in your diet. That's why I recommend to my patients that they take a fish oil. It's hard to get enough omega-3s. Typically, people with sad American diet, their omega-3s their omega-6s to omega-3s are about 5-to-1, 3, 4, 5, 6-to-1. If you have a chronic illness, especially if you have a lot of inflammation, especially if you have autoimmune disease, it's probably 20-to-1. You're just not getting enough omega-3s. So I take 3 grams of fish oil a day, and I recommend my patients take a couple of grams of fish oil a day. So that's 2,000 milligrams of fish oil a day. It's a potent anti-inflammatory, really important for healing up the gut. So when you start to have digestion and elimination problems, in particular digestion problems, where you're not digesting your food, so you start getting, and the symptoms are bloating, gas, indigestion, that kind of thing, or you eat and you have to run to the bathroom, you've got so much inflammation that you have a dumping syndrome. You're not absorbing your nutrients. So now you start to develop these nutritional deficiencies. If you're not getting enough of the B vitamins, and most people are not, and that's what the American Dietary Association shows us, that most people are not getting enough B vitamins. People who are under a lot of stress, in particular, are deficient in magnesium, because you need magnesium to deal with stress, but also B vitamins. And what we see is once you start to deplete magnesium, it sets up all kinds of problems, because magnesium is a natural muscle relaxer. When you become deficient in magnesium, you start getting muscle cramps, tight muscle pain, soft tissue pain, migraine headaches, mitral valve prolapse, high blood pressure. Magnesium is needed to make the happy hormones, norepinephrine, serotonin, dopamine. Without it, you're at risk of becoming depressed, becoming anxious, to have poor sleep. The magnesium's in 300 different bodily reactions, and it can easily be suppressed if you're under stress. And one of the major stressors is poor diet and poor sleep. So make sure you're taking a good multivitamin. I recommend you get about 400 to 500 milligrams of magnesium in your multivitamin. There's not a lot of them out there, but you can look for them. My patients typically take either the Fibro formula, which has 680 milligrams of magnesium in there. I recommend magnesium glycinate or citrate. Those are the ones you absorb the best. Magnesium natural muscle relaxer, B vitamins. So if you're not digesting your food, then a lot of times, and if you're taking, you'll see here in just a minute, if you're taking a proton pump inhibitor, or you're taking an antacid, a prescription antacid, you deplete your calcium, because you can't make calcium, and you start to deplete thiamine and B12. Now, once those start to go low, you might start problems with anxiety, depression, poor energy, low moods. You also start having trouble with mental clarity. I've had patients that I would test, they were saying that their doctors tell them they're heading into pre-senile dementia. They can't remember anything. Now, a lot of my patients with fibro had a thing called fibro fog, but this brain fog can affect anybody. But when you start to deplete thiamine and some of these other B vitamins, your mental clarity goes down. And that can happen just from poor diet. And also it can happen from just not absorbing your food. So there's the Fibro formula. We'll go into detail. There's the 5-HTP. This is when the 5-HTPs combine with the right vitamins, minerals, amino acids, essential fatty acids, like the Fibro formula, this is what it does. It decreases pain, helps with sleep, reduces tender points, helps with anxiety, improves moods, and helps to correct irritable bowel syndrome. But you see these little diagrams here. So you see when you start to eat, even looking at food, even smelling food, the salivary glands are starting to release these enzymes to get the saliva in there to start to break down the food as you put it in your oral cavity, start to chew it up. It goes down the esophagus, right? And then it goes into the stomach. Now, what separates the stomach from the esophagus is a trap door. I call it a trap door, called the esophageal sphincter. And it's like a little trap door that opens up as that food is coming down the esophagus. The stomach is releasing stomach acid, hydrochloric acid, and that stomach acid goes up. It's being released because that's what digests your food. But as that stomach acid is being generated by the body, because it smells this and now it's feeling food coming down the esophagus, that stomach acid causes the pyloric sphincter to close after the food goes down into the stomach. You don't want the food to come back up, right? That's heartburn, that's reflux, that's gastroesophageal reflux is what that is. And so when you eat, the stomach acid is supposed to go back up and cause that trap door to close, so you don't get any acid or food back up into your esophagus. You're told that the reason why you have heartburn or GERD or this reflux or burning is because you have too much stomach acid. And that's not true. The truth is you don't have enough. Because what we see is, and this has been validated, I mean, there's numerous studies. You can do a Heidenberg study, and they've shown this over and over again. But what happens is when you deplete your stomach acid in your stomach. And that occurs after years and years of eating processed food that has no enzymes in them. When you eat fruits and vegetables, they have enzymes in them that allow you not to have your digestive system not to have to work so hard. But if you're eating processed foods and you're eating a lot of, fake foods, it's not real food, you're not getting that help that you need with digesting that food. And so over a period of time, your stomach can become depleted in its ability to release the stomach acid. You have some stomach acid in there. It's just enough to leak back up into your esophagus and give you that burning pain, the reflux and heartburn. But it's not enough to close the door to prevent it from hanging out in your throat. So what you want to do is you want to take digestive enzymes to turn that around. Your stomach is the only place in your body that's acidic. Everywhere else is supposed to be alkaline. So the stomach is incredibly acidic. It's 2, 3. It's if you were to take the stomach acid out somewhere, it would burn. That's what it does. The rest of your body is at 6 or 7, or we hope at least it's 7, can be higher. But your digestive system really is dependent, and your elimination system is dependent on the stomach being able to break that food down, and that process is dependent on the stomach acid. If you deplete that stomach acid, the food comes down, sits in your stomach. What little acid goes back up in your throat. You might experience some heartburn, and then it sits in your stomach because it doesn't initiate the next reaction, which is your pancreas, which you can see here, that little yellow or gold organ there, that diagram there, you see the pancreas. When the stomach acid is released in the stomach, it causes the pancreas to release enzymes to break down protein and fat. If you don't have stomach acid, then that food sits there because the enzymes are not breaking it down. It's not initiating the pancreas to do its job. And so now you could just get malabsorption where it sits there for a little bit and then you have to run to the bathroom, or you become constipated, or it does finally get into the small intestine, okay, but you didn't digest the protein. So now you've got this undigested protein. You're not getting the amino acids out of there, which again are crucial for making your hormones and giving you good health. You've quickly become depleted. And it all started because of low stomach acid. So the first thing I really want to encourage you to do is make sure you're taking a digestive enzyme every time you eat, whether you have heartburn, reflux, GERD, irritable bowel, small intestinal bacterial overgrowth, yeast overgrowth, leaky gut, food allergies, any kind of GI problem. You need to be taking a digestive enzyme every time you eat. And really, if you've got a chronic illness, and really just about any, and I take a digestive enzyme every time I eat, just to be sure that I'm breaking down my food and getting those nutrients. But after the age of about 35, 40, most people have eaten such a sad American diet, all these processed foods, they have a problem with digestion. So you want to take a digestive enzyme as you start to eat. We don't have time to go into that. So the stomach acid is crucial. These are the things that it does. It breaks down proteins for digestion. Again, the importance of that is that proteins are loaded with amino acids. That's what they are. They're amino acid bus. They're a bus full of amino acids. Every protein has a different amino acid sequence, so they have different ones. But when you eat protein, the purpose of that is not just to get the calories, it's to get these nutrients that are in the protein. So everyone talks about you need enough protein, Why is that? Well, protein is the building block of all your different tissues, but it's a building block because of the amino acids. That's crucial, okay? It activates the digestive enzyme pepsin to break down the protein. So without the stomach acid, you can't do that. It alerts the pancreas to release pancreatic enzymes. Without stomach acid, that doesn't happen. It prevents the growth of bacteria, yeast, or other possible pathogens. So this is your first line of defense when you take something in from the outside world into the rest to you. So this is one of the things, with food allergies, it's the great masquerader. It can cause any problem out there. But you're taking in foods that have bacteria, they have viruses, they have fungus, they have toxins, they have all kinds of things in the food you may not even know on a microscopic level. But when you take it in and you eat it, so the outside world is coming in, you expose yourself to these potential toxins, allergens, etc., pathogens. The stomach acid destroys that. That's what it's supposed to do. But without the stomach acid, you're at risk. So smelling food starts the process. So if you're not digesting your food, if you don't have the pancreatic enzymes, if you've removed if you've had if you have your gallbladder taken out, and you start to see that your stools float in the toilet bowl instead of going to the bottom, that's a sign you're not digesting your fat. And that's very common. And the reason why is because you don't have the digestive enzymes. You don't have the bile from your gallbladder to break it down. Taking digestive enzymes will turn that around, making sure that you're digesting the fat. Here's the different enzymes. So low stomach acid can create leaky gut, amino acid deficiencies, B12 deficiencies. You can't absorb calcium, magnesium, and other minerals. It's kind of ironic that they tell you that you should take Tums, which has calcium in it. You can't even absorb it. When you block that stomach acid, you can't absorb calcium. Now, this is where we start to see issues with osteoporosis and osteopenia, bone loss, and bone weakening and fractures. So here's the different things that cause it, aging and eating. But the big thing is eating processed foods year after year after year after year. Low B12, B vitamins, magnesium, zinc deficiency create a problem. But stress is a big one. Stress is a big one. Are antacids the answer? No, because as I just shared with you about this whole thing about the esophageal sphincter, taking an antacid is going to block the stomach acid, which you really don't have any anyway. That's it. The bloating, the gas, the indigestion, the reflux is a warning sign that you've got a problem. The problem is you don't have any digestive enzymes. You need to clean up your diet. Antacids are potentially dangerous, again, because they suppress the stomach acid. You're up to 800 times more likely to have an infection in your gut. You increase the risk of small intestinal bacterial overgrowth. You increase the risk of C. diff, which is a nasty thing. You have up to 160% increase of risk of pneumonia, 125% increased risk of bone fracture, 200% increased risk of stomach cancer. You think you want to get off those antacids? Of course you do. Of course you do. So I want to get you to, this is what I put my patients on, a digestive enzymes, helps to break down fat, protein, and carbohydrates, and then allow your pancreas and the rest of the digestion elimination system to work like it's supposed to. You take one of these with each meal. If you're eating a snack, I wouldn't worry about it. But when you start to eat, this is when you want to take the digestive enzyme. So, and I've got a bunch of testimonials. You can see these, but anyway, you can see them on the store. They're probably on there as testimonials to that product. When you eat, you want to be relaxed. That's key. So many people are just, and I don't know why is it now you go in a restaurant and every restaurant now seems, maybe not fine dining, but most restaurants have, a bank of TVs going, blaring. They have loud music going. It's loud. That's not helping your digestion. When you sit down to eat, if you're so inclined, say a little prayer, but I encourage you to be grateful for the food that you have and the nourishing effect that it can bring in the right environment. Take some deep breaths. And nonchalantly, just be conscious of what you're doing and be grateful. Go easy on fluids because that's going to not saturate. Excuse me. It's going to cause your stomach acid to go lower. And so don't drink a lot of fluids when you eat. Everybody's got to drink all this stuff. No, you don't. You really don't want to do that. And again, you don't want to have tea or coffee because that can certainly cause irritation and problems with absorption. Again, these are, digestive enzymes. This is the Jumpstart Fibro Pack. This is the 4 products that all my fibro patients go on. And then we look at, your food is supplying the raw ingredients that you need for the body to work. So the hormones, the chemicals, the biochemicals, these things, the vitamins and minerals, essential fatty acids, amino acids, these things that the body needs to work correctly. And part of that is to get your metabolism, your cellular energy to work correctly so that the cells can communicate with one another. They can adjust to the environment that they're in. They can release inflammatory chemicals if you need them because you've cut your finger. They can turn inflammation down if you've come in contact with a virus. They can turn inflammation up. Your metabolism is controlled by your diet, largely by your diet. It's also controlled by your weight, unfortunately. So if you're carrying around an extra weight, that dramatically slows down your metabolism. Low thyroid, low DHEA levels, poor sleep, all those things can really compromise your metabolism. And you may or may not gain weight, but you certainly are vulnerable to a lower energy state, both in your cells and mentally, physically. You're going to see oftentimes it really sabotages your body's ability to work at optimal levels. Every function in your body slows down. Digestion, so you start getting problems with digestion, bloating, gas, indigestion. Elimination, so you become constipated. Fatigue, brain fog, low moods. Poor nerve communication, so you might start getting tingling in your hands and feet or cold hands and feet because poor circulation. So when you're ready to correct your metabolism, Here's a few steps. One is consistent good night's sleep. Make sure you're taking a good multivitamin. My patients are taking either the fibro formula or if you're not a fibro patient, then they're taking the liquid multivitamin. Start to repair the GI problems. So we're talking about that now, and shore up any thyroid, adrenal, or other hormonal deficiencies, which we can't go into detail about tonight. This is the healthy diet that I like to put my patients on. What you see here is really any vegetable really is okay, and most all fruits are okay, even though it's just got several here. Now, again, you want to steer clear of the fruits that are on the Dirty Dozen list, okay? Unless they're organic, okay? What you don't see out here is what? Grains. You don't see wheat, you don't see barley, you don't see oats, you don't see rice, you don't see sugar, you don't see the things you steer clear of, sugar and all that kind of stuff. But grains are really hard on your intestinal tract. A little are okay, okay? This diet is really meant for long term. It's meant to lose weight and then to be on long term, adding back some grains. If you can tolerate the grains, and not everybody can, you may be gluten intolerant. But this is the diet that I encourage my patients and customers to be on. Unfortunately, most people can't do that diet if they're trying to stay on this long term and lose weight. So if you need to lose weight, this is the diet that I recommend, combined with appetite suppressing, fat burning drops that allow you to do that. And these drops, they've sold over 1 million bottles. There's two different bottles that come in the package. There's a Slender X, which curbs your appetite and helps to burn visceral fat. That's that unhealthy fat, that belly fat that increases your risk of heart attack and stroke. And it helps the digestive system. Then the Accelerate helps your metabolism. So it helps your metabolism go up so you burn calories more effectively. And it also tones down, balances hormones to tone down this stressful eating that some people are plagued with, many of my patients, whether that's sugar cravings or junk food cravings. This formula right here is designed to really to shut that down. So it works on these different hormones. So the first hormone it affects is ghrelin. So ghrelin goes up when you're hungry. But once you start taking the drops, what you see within a few days is your ghrelin levels, these hormones, are suppressed. So now within a few days, you're really not even hungry. You're eating maybe a meal or two a day, and that's it. It balances out your stress hormone cortisol to eliminate sugar cravings and the stressful eating that some people, this food chatter that people have where they're always thinking about food and thinking about chocolate and sugar and whatever it is, junk food, whatever it is. It really just tones all that down to you get rid of that nervous energy. And that happens within a few days as well. Sugar cravings go away within a week. Then the other thing it does is it raises your leptin hormone, which is your satiating hormone that tells you that you're full. So within a couple of days of starting, you're not hungry, you don't feel as stressed out, helps to balance your hormones. And then when you do eat those meals that you do eat based on the allowed foods, what you see is you just start to eat and you're full. You're eating about a third or half of what you normally would. Now, normally when you cut your calories like that, you can do that for a week, 10 days, maybe 2 weeks. But then your body thinks it's starving and you quit losing weight and you're miserable, irritable, can't sleep, you feel terrible, have no energy. And then you start to gain weight when you go back on your diet because you just can't stay on that. It's the yo-yo diet that everybody's kind of gone through. That does not happen on this diet. And unlike the GLP-1 shots, the weight loss shots, doesn't destroy you. It doesn't cause you to lose muscle tone like those shots do. It doesn't cause gastroparesis where your digestion system just shuts down and some of my patients have gone to ER because of that. And really the purpose of it is to get you eating a healthy diet to lose weight and then to stay on that healthy diet once you lose the weight. Unlike the GLP-1 where you just are eating less junk food, the sad American diet. But then when you go off the shots, and eventually you will, I mean, even if you're getting them over the off label, they're still $400 or $500 a month, whatever they are. But if you go off of those, you go off the shots, then you start gaining the weight back. I mean, that's what happens. And you're back on it. You're still eating a junk food diet. So I don't see the benefit of that. Yeah, there's a time and a place for those shots, but you can do it with this diet and these drops. I want to talk about irritable bowel real quick and share with you. So with irritable bowel, there's 3 forms of irritable bowel. irritable bowel A, where you go back and forth. So you alternate. So one day you're constipated, next day you have loose bowel movement, so you back and forth. Irritable bowel C, where you're constipated, can't have a bowel movement for 2, 3, 4 days, whatever it is. Irritable bowel D, where you're primarily, every time you eat, when you do have bowel movement, it's a loose bowel movement. So you can be in any of those, right? This is how you turn that around quickly. To me, 70 or 80% of my patients had irritable bowel. It's so common. And chronic illnesses, the patients that I worked with, 70 to 80% of them had irritable bowel syndrome. And irritable bowel syndrome is a syndrome. It doesn't cause anything. It's just a name given to describe the symptoms, the warning signs that your digestion and your elimination system is not working correctly. It's not that you need an antacid because you don't have enough acid. It's not that you need Bentyl, calm your stomach down, or you need Linsis to go to the bathroom because you're chronically constipated. No, it's none of those drugs all have potential side effects. What you want to do is correct their underlying causes. So let's talk about that. So the first cause of irritable bowel syndrome is poor digestion. And so you want to make sure you're taking digestive enzyme. Every time you eat, you take a digestive enzyme. The other second thing is just poor diet. You've got to clean up your diet. You need to get more fruit and vegetables, get more fiber, get rid of the seed oils, get rid of the sugar, which creates inflammation, get rid of the grains, which are really hard on the intestinal tract. It doesn't mean you can't ever have those. But if you're where you're at right now, you feel like, wow, I'm just not as healthy as I'd like to be, then at this point, or if you're really suffering, clean your diet up. Clean your diet up. Take a digestive enzyme. The next thing you want to make sure is you're getting a good multivitamin with plenty of magnesium and B vitamins. My patients take the Fibro formula. If you don't have fibromyalgia, you can take the liquid multivitamin. But you want to make sure that you're providing those nutrients that your body needs to digest your food and to have a proper elimination. So magnesium, as I shared with you earlier, is a natural muscle relaxer. It relaxes tight, achy muscles, but it also relaxes tight colons. So if you're constipated, if you have irritable bowel A, you're going back and forth, make sure you're taking a good multivitamin, not just magnesium, but you need to be taking a good multivitamin. Take that and make sure you're getting about 400 or 500 milligrams of magnesium every day in that supplement. If you need a supplement because your multivitamin doesn't have that, like the liquid multi, you're going to need to supplement some additional magnesium. If you are constipated, keep increasing your magnesium. So you're clean up your diet, taking digestive enzyme, and now you go from alternating to where now instead of having loose bowel movements, you're still constipated, or maybe you're still going back and forth. Let's keep it there. Then what you want, if you're staying constipated, increase your magnesium. Keep increasing by 150 to 200 milligrams every day until you have a normal bowel movement. If you have a loose bowel movement, reduce your dose of magnesium. I recommend magnesium glycinate, citrate, or chelate. Those are the ones that you absorb the best, and they're the most efficient. You get the most out of them. Those are the ones you want to be looking for. That's what we have on the store. So if you're the constipation, clean up the diet, digestive enzyme, and magnesium. That's super important. If you're having loose bowel movements, digestive enzyme, cleaning up your diet, you need to be in a good multivitamin, enough magnesium. Now, the thing I want to share with you is that some of you may be taking too much magnesium. So if you add the Fibro formula or you add the liquid multi or some things I'm talking about tonight, look at the things you're already taking to see, do you have magnesium in it? Because sometimes what happens is I share this protocol with my patients, and I always tell them this though, is that when they add this additional magnesium, like the Fibro formula, which has 680 milligrams, if they're not careful, it may be too much for them because they could be taking a hair, skin, nail formula or a bone formula or something else or another multivitamin, which you don't need to take if you're taking the Fibro formula or the liquid multi. But make sure that's not causing your loose bowel movements. Okay, having said that, you start adding the magnesium and you get loose bowel movements all of a sudden, reduce your dose. Okay. Now, what do you do for irritable bowel D? So that's diarrhea. You just have loose bowel movements all the time. I recommend you make sure you're taking 5-hydroxytryptophan. So 5-hydroxytryptophan combined with the multivitamin Fibro formula or the liquid multi, the liquid multi has amino acids in it like the Fibro formula. Most multivitamins don't, so that's why they don't help. But the liquid multi and the Fibro formula have amino acids in there. And when combined with the Fibro formula, the B vitamins and the magnesium and the vitamin C, that turns into serotonin. As that serotonin level goes up, what you'll see is now your bowel movements start to become regulated and you'll start to have formed bowel movements. Okay. The last thing I want to encourage you to add is a good probiotic. The probiotic, the good bacteria, is designed to help you digest your food and to utilize that food, optimally utilize the nutrients in that food. A good probiotic should be about 20 billion count, 20 billion CFU on a daily basis. You'd be taking a probiotic. Now, you can take some time off. You don't take a probiotic all the time, but if you hadn't taken one in a while, I certainly would take one daily for the first month. And then if you want to take it every 2 or 3 days, that's fine once you build it back up. But your gut and your brain communicate together. And when that bacteria is suppressed, when you don't have enough of that good bacteria, you open up the possibility of getting an overgrowth of bad bacteria that takes over, and that can create leaky gut. You also open up the possibility of yeast. We all have yeast in our guts. We all have yeast. It's normally dormant. It doesn't cause a problem, just like bad bacteria. We have bad bacteria in our gut and we have good bacteria. Normally, that good bacteria keeps the yeast and the bad bacteria in check. But once you lose the good bacteria over a period of years of eating a junk diet or taking antibiotics or getting under a lot of stress or taking non-steroidal anti-inflammatories, which create leaky gut. But once you lose that, now this bad bacteria and the yeast start to take over the intestinal tract. And the yeast, we don't have time to go into it, but I'm going to show you where you can see the protocols. But the yeast, they have these little tentacles, picture like an octopus, and they attach to the lining of the cellular, the cell wall there of the intestinal tract, and they punch holes through it. Now you got leaky gut from the yeast. And once the yeast starts to leak out in the body, it can create all sorts of problems. One of the things that yeast do is compromise your mental clarity. Yeast is like alcohol. So that's what it is. And so, if you ever had too much alcohol, didn't feel real clear-headed, that's the thing that can happen with yeast causing brain fog. But it can also cause, same thing with food allergies, all sorts of problems. Now, you can go to superhealthyhuman.com. That has a little bit more focused on my heart disease book and diabetes book that it's coming out soon, by the way. So you'll see that on there, and the anxiety and depression. But if you go to yourfibrodoctor.com and you go to patient center, okay, and then all you have to do is click health. There's all kind of free, videos and all kinds of stuff. But if you want to go to health conditions, this is where the protocols are. So let's look at allergies because I hadn't had a chance to go through this, but you can see there's a little video about that. Here I am, but you can see what it is and then what I recommend, how you treat it. And you see leaky gut. So there's protocols for leaky guts. There's natural supplements, and I want to encourage you to also look at it's not on here. Oh goodness, I'm so sorry. Maybe it is here, but you can come here. Let's just say this is the blog. Type that in. Let me see. Here we go. So elimination diet. I'll tell you how to do elimination diet. If you get my fibro book, it's in there. The elimination diet. There's a chapter on food allergies, chapter on leaky gut, chapter on yeast overgrowth, chapter on sleep, chapter on thyroid, chapter on adrenal fatigue, chapter on diet. It's all in there. But if you want to see the elimination, you can do it that way. Let's go back to health conditions though. So if we look at health conditions, we can look at, so there's allergies. We talked about that. Digestion, elimination, GI disorders. So there we go here. Okay. So that's all here. You can see here are the protocols here, what I recommend. Okay. And we talked about intestinal permeability. So there we go. And this may have the elimination diet on it because you want to do the elimination diet. There's the leaky gut formula that I recommend my patients. That's what they use. And here's a little bit about the leaky. Yeah, I'm sorry. Here's the elimination diet, a little bit about. Okay, right through here. So you can see that, tell you how to do that. And then here's the protocols for irritable bowel. This is an article I wrote for one of Physician Magazine journal. But here's, and this is how you do it right here. So we'll tell you how you do it. And then I think we talked about sleep disorders. It's all right here. So it's all there for you. I know I didn't get into as much detail as I'd like to. We didn't get to talk about H. pylori or stomach ulcers, but that's all on here. Yeast overgrowth, so you can see. But it's all right here for you. It's all there. Hopefully it's, it's something that, that you're going to benefit from. It's that material there that's going to be helpful. I think it will be. But it's all there for you. So I've gone over. I've had so much fun sharing this. I hope it was helpful. I want to open up the chat box. So you can see it down here on the bottom of your screen. See this chat? So if you want to, you can just pop a question in here, comment, whatever you want to do. Tell me where you're from, what's going on with you, and I'm happy to answering your questions. Oh, by the way, I almost forgot. Tonight only, for this group who are on here, because I really applaud you for being proactive and being on here. So many people wait for the recording. I don't send out all the recordings, by the way. You may know that. If this is the first time you've ever been on my Wednesday night lives, I want to encourage you to go to the website yourfibrodoctor.com, or maybe even better, superhealthyhuman.com, and you'll see some free reports that you can download or you can get on the newsletter. And then once you're on our email list, you'll get notified anytime I do these talks. I typically do them on Wednesday night, but also do them sometimes. I'll have a 2 or 3 hour one on the weekend. Sometimes I do during lunch. Get on the email list so you know when these are going to occur. And then you also get privy to specials and things that we're doing. So tonight, for the next hour and 45 minutes, I think that's right. I think how we got it set up. You can use the code in all caps, tonight 20, all caps, capital letters, tonight 20. If you put that code in, when you go to checkout, you'll get 20% off anything you order on the store tonight. So the store you can access it at the website, or you can go to yourfibrostore.com or essentialtherastore.com. And once you get on there, you'll see the different products that I mentioned tonight, including, by the way, you can save 20% on the Slender X weight loss drops. Typically, you lose about half a pound a day on those drops. If you're a female, a pound a day. If you're a male, when you get those drops, it comes with a diet, and then I send you a video, kind of gives you tips and tricks. And then you also have access to a membership site if you want it. It's a Facebook group where you can go and you can post questions and get recipes and all sorts of things that are there. But that's tonight. It ends at 9 p.m. Central Standard Time. So if you want to save a little money and help your health in the process, you can order those products, any product. We made it across the board. Use tonight in all caps, 20%, and that's good for the next an hour and 45 minutes. Then we'll pull that off, because I don't want anybody else to benefit from this. The people that are on here are the people that should benefit. You're being proactive. You want to learn how to get healthier and live a life that's enjoyable and be able to live that way for a long time, I hope. So what can be done for GI tract spasms and cramps? Well, the first thing I'd say is make sure you're taking plenty of magnesium. But the second thing I'd say is just everything I mentioned: digestive enzyme, clean up your diet, making sure you're getting plenty of magnesium. What's causing the spasms? What has your GI doctor told you? I mean, where's that? What's the trigger? Where is it? You may need to have a stool test to see if you have parasite, but I would suggest starting just with the basics. What I think people try to put the cart in front of the horse, and really if you'll start with the basics, oftentimes that's all you need to do. That's without doing any kind of testing on you. That's what I would share with you. If you're not taking magnesium, which is a natural muscle relaxer, that's what I do. If you're getting cramps, spasms, I would assume maybe you're getting dumping syndrome as well. So good probiotic. And you probably have tried some of these things, I would imagine. But experiment with taking, if you're getting loose bowel movements in particular, take 5-HTP. By the way, I didn't mention this, I'm so sorry. But if you continue to have loose bowel movements and you're doing the irritable bowel protocol with digestive enzyme, 5-HTP, multivitamin, plenty of magnesium, a probiotic, and you continue to have loose bowel movements, now S. boulardii is not a probiotic. It's a prebiotic. It helps you to produce more good bacteria. And it's not a bacteria. It's actually a yeast, but it's a healthy yeast. But S. boulardii can help with those chronic loose bowel movements. But start with the other protocols, because that's what you're trying to do, is correct these underlying issues. And then if you need to add that S. boulardii, do. Okay. Well, I had a blast. Okay. Yes. If I take the digestive enzymes, will I be able to eat green leafy vegetables? Should be able to. Make sure you take the digestive enzymes, 20 minutes or so, before you start to eat in your case, but you should be able to without a problem. If you experience problems on those digestive enzymes, then I would recommend in your case is you take a veggie enzyme, which is a little bit different. It goes to work a little quicker. The problem with the veggie enzymes sometimes, though, it's not broad enough to help with the pancreas. So, but in your case, if you start with the regular digestive enzymes, which is the easiest thing to do because it checks off so many boxes, and you still have that issue, then add the veggie enzyme. If that doesn't do it, then reach out to me here one night and we can go into more detail. You're very welcome. I hope that was helpful. I wish I had a little more knowledge about your condition to get a little more detail, but obviously without a consult, I can't do that. But again, thank you. I'm sorry I ran over. The topic next weekend, we're going to look at mood disorders, so anxiety, depression, mental clarity, so brain fog. We're looking at how you can increase your mental clarity, increase your mood, so have better moods. But if you have any issues with anxiety, depression, have a family member, child, spouse, whomever. So thanks so much and have a wonderful evening. Look forward to meeting some of you maybe in a consult or maybe one of these talks next week.
Thanks for listening to Super Healthy Human with Dr. Rodger Murphree. Remember, your body is designed to heal. It just needs the right tools. Stay curious. Stay consistent. Stay super healthy. If this episode helped you, leave a review or share it with someone who's ready to take charge of their health. The information provided in this podcast is for educational purposes only and should not replace professional medical advice, diagnosis, or treatment. Always consult your physician before making changes to your health regimen. This content does not substitute medical care.